Have you ever noticed that after turning 50, you suddenly need to use the bathroom 3, 4, sometimes 6 times a night? You lie down, you finally feel your body relax, and just as your eyes close, that familiar pressure builds again. You get up in the dark, you stand there longer than you used to, and even after you're done, it doesn't feel finished. Most men brush this off. They think, "That's just what happens when you get older, doctor." But I need to tell you something today that very few men ever hear from their own doctor. Age is not the real cause. What's actually happening is that 5 ordinary habits, things you probably do without thinking twice, are quietly damaging a small gland that controls far more of your health than you realize. I'm Dr. Samuel Reed, and today I'll walk you through exactly what these 5 silent habits are, why they hit men so hard after 50, and what you can start doing today to protect yourself. Stay until the end, because the 5th habit is one almost nobody talks about, and it might be the most damaging one of all. Let me start by giving you a clear picture of what we're actually talking about. The prostate is a small gland, roughly the size of a walnut in your 20s and 30s. It sits just below the bladder, wrapped around the tube that carries urine out of the body. For most of your life, it works silently in the background. You don't feel it, you don't think about it, and it doesn't cause you any trouble. But somewhere around the age of 50, that quiet gland can begin to change. It can slowly thicken, slowly expand, until it starts pressing on the bladder and the urethra without you even realizing what's happening inside your body. According to the American Urological Association, more than half of men over 50 show some signs of prostate enlargement, and that number climbs even higher as men move into their 60s, 70s, and 80s. But numbers on a page don't tell you what this actually feels like in real life. Let me tell you about a patient of mine, Robert, 61 years old, a retired mechanic. He came into my office exhausted, the kind of tired that coffee can't fix. He told me, "Doctor, I wake up 5 times a night, sometimes 6. By the time morning comes, I feel like I never slept at all. My wife says I'm irritable, my memory feels foggy, and honestly, I don't even feel like myself anymore." Robert didn't realize his nighttime bathroom trips weren't just an inconvenience. They were the visible symptom of something much deeper. Every time his sleep was interrupted, his body lost the chance to repair itself. Deep, uninterrupted sleep is when your body produces hormones, repairs damaged cells, and restores your nervous system. When that sleep gets cut into pieces 5 or 6 times a night, none of that repair work gets finished properly. Over time, this creates a chain reaction. Higher stress hormones, a strained cardiovascular system, a foggy memory, and yes, even changes in sexual function, something many men are far too embarrassed to bring up, even with their own doctor. Now here's something most men don't know. There are actually 2 very different reasons why you might be getting up at night to urinate, and they require completely different approaches. The first is a mechanical problem, an enlarged prostate physically squeezing the bladder, which shrinks how much urine it can comfortably hold. Even a small amount of urine can suddenly feel urgent because there's simply less room. The second reason has nothing to do with the prostate directly. Sometimes the kidneys are producing too much urine overall, often linked to unstable blood sugar or early insulin resistance. When there's excess sugar circulating in your blood, your kidneys work to flush it out, and water follows that sugar right out of your body, which means more trips to the bathroom, especially overnight. Add in evening habits like drinking too much water late at night, or having a glass of wine or a cup of coffee before bed, and you've made the problem noticeably worse. Alcohol dehydrates your body and irritates the bladder lining. Caffeine is a powerful diuretic. Drinking plenty of water during the day is genuinely healthy, but drinking it all in the hours before bed is what disrupts your sleep. So why does the prostate actually enlarge in the first place? Is it purely age, or is something else happening inside your body that nobody has ever properly explained to you? The answer might genuinely surprise you, and once you understand it, everything else in this video is going to make a lot more sense. Most people, including a lot of my own patients, assume prostate enlargement is simply a natural consequence of getting older. Age plays a role, yes, but it's a side effect, not the actual root cause. The real explanation lies in an internal imbalance, hormones, metabolism, and daily habits that many men have carried for decades without ever connecting the dots. Here's the part almost nobody explains clearly. Testosterone, your primary male hormone, naturally declines with age. Everyone knows that much. What most people don't know is that your body converts a portion of your remaining testosterone into a much more potent compound called DHT, or dihydrotestosterone, roughly 5 times stronger than regular testosterone at stimulating prostate tissue. DHT is what drives the cells of the prostate to multiply and thicken. That's the paradox. Your overall testosterone is falling, but the hormone actively attacking your prostate is becoming more active. Your body has natural systems to keep this balance in check, but chronic stress, poor sleep, and a diet high in sugar and refined carbohydrates disrupt those systems, letting DHT run far more aggressively than it should. Then there's insulin, a hormone most people only associate with blood sugar control. Fewer people realize insulin is also a powerful growth signal throughout the body. When you regularly eat large amounts of refined carbohydrates, white bread, white rice, pastries, sugary drinks, your blood sugar spikes and your body pumps out more insulin to bring it back down. Do this for years, and your cells start resisting insulin's signal, forcing your body to produce even more just to keep up. Chronically elevated insulin activates growth pathways throughout your body, including prostate tissue, essentially telling that gland to keep growing. Research published in the European Journal of Urology found that men with metabolic syndrome, excess weight, elevated blood sugar, and poor cholesterol markers faced a significantly higher risk of prostate enlargement than men with stable weight and healthy blood sugar. That's exactly why men carrying extra weight around the midsection often develop more severe prostate symptoms and develop them earlier in life. There's a third factor almost nobody discusses. Modern life exposes our bodies to a surprising amount of artificial estrogen-like compounds, from plastic food packaging, heavily processed foods, and oils repeatedly reheated in commercial frying. These compounds interfere with your natural hormone balance, subtly shifting the ratio between testosterone and estrogen. When estrogen activity increases relative to testosterone, prostate tissue tends to respond by continuing to grow. And finally, 2 nutrients that deserve your full attention. Your prostate actually has receptors for vitamin D, meaning this gland listens for signals from vitamin D to help regulate its own growth. When your body runs low on vitamin D, the prostate loses one of its natural brakes, and fibrous tissue inside the gland can thicken more rapidly, adding pressure on the bladder. Plenty of men in sunny climates are still deficient, simply because they spend their days indoors, in cars, or covered up. Magnesium is the other overlooked piece, a mineral that relaxes the smooth muscle in both the bladder and the prostate. When magnesium runs low, the bladder becomes more prone to sudden, involuntary contractions, part of why some men urinate frequently at night, even when the prostate isn't significantly enlarged. Magnesium glycinate tends to absorb far better and also supports deeper, more restful sleep. So to put it plainly, an enlarged prostate doesn't appear out of nowhere. It's the slow result of years of hormonal imbalance, poor metabolic health, and nutrient gaps that build up quietly in the background. The encouraging part is that once you understand this mechanism, you can actually do something about it, and it doesn't start with medication or surgery. It starts with recognizing the daily habits that are quietly making this problem worse, and that's exactly what I want to walk you through next. I hear this question constantly in my clinic. Doctor, I don't drink much, I eat reasonably well, so why is this happening to me? And when I dig a little deeper with these patients, I almost always find a handful of seemingly harmless daily habits that have been silently causing damage for years, sometimes decades, without them ever noticing. Habit number 1 is sitting for long, uninterrupted stretches of time. Think about what happens during 3 or 4 hours of continuous sitting, whether driving, working at a desk, or relaxing on the couch after dinner. Blood flow to your pelvic area slows significantly, circulation becomes sluggish, and your prostate sits right in the middle of that stagnant zone. When blood doesn't circulate properly through that tissue for hours at a time, it creates the conditions for low-grade, simmering inflammation, essentially placing that gland in an oxygen-starved environment day after day. I see this constantly with office workers and men who settle into the couch after dinner without standing up once until bedtime. That pattern, repeated daily for years, accumulates into real damage. The fix is simpler than you'd think. Every 45 to 60 minutes, stand up, walk a few steps, gently rotate your hips, move your body for 2 or 3 minutes. That's enough to get blood circulating again and give your prostate the chance to breathe. Habit number 2 is holding in urine when you feel the urge. This is incredibly common among busy professionals, men in back-to-back meetings, long-haul drivers, or anyone whose hands and schedule are constantly full. Every time you delay urinating, your bladder stretches and fills further, and a full, distended bladder presses directly against the prostate sitting just beneath it. Repeat that pattern daily for months and years, and you create a chronic, low-level inflammation affecting both the bladder and the prostate. The solution here is straightforward. Train yourself to urinate as soon as you genuinely feel the need, especially first thing in the morning and right before bed. Don't let your bladder sit under pressure longer than it needs to. Habit number 3 is simply not drinking enough water throughout the day. A lot of men do this intentionally, avoiding water because they're worried it'll mean more bathroom trips, which creates a dangerous cycle. When you drink too little, your urine becomes concentrated, carrying a higher load of waste products and irritating compounds, and every time that concentrated urine passes through the urethra, it brushes directly against prostate tissue, creating irritation that accumulates over time. Chronic dehydration also raises your risk of bladder stones, more common than most people assume. Aim for roughly 1.5 to 2 liters spread evenly across the day, tapering off in the evening rather than loading up at night. A small trick that helps many patients is adding a pinch of electrolytes to your morning water, which helps your body absorb hydration more effectively and reduces thirst later at night. Habit number 4 is the combination of spicy food, alcohol, and too much caffeine, particularly later in the day. This trio is genuinely hard for a lot of men to give up. 1 cup of coffee in the morning is generally fine for most people, but caffeine later in the day increases blood flow to the pelvic region, irritates the bladder lining, and disrupts the deep sleep your body needs for hormone production. Bottled tea hydrates the body, weakens bladder muscle control, and interferes with hormone balance, and even 1 or 2 evening drinks can noticeably increase how often you're up at night. Spicy foods increase pelvic warmth and can create a burning sensation during urination for some men. None of this means total elimination, but it does mean moderation, and timing matters just as much as quantity. Cap coffee at 2 cups a day, only in the morning, and switch to warm water or mild herbal tea by the afternoon. Cut back on alcohol gradually, aiming for no more than a couple of drinks per week. If you love spice, try ginger or turmeric instead, which bring warmth to a meal while actually calming mild inflammation rather than fueling it. And now, habit number 5, the one I promised at the start of this video, and honestly the one I think deserves the most attention because almost nobody connects it to prostate health at all. That habit is chronic sleep deprivation combined with ongoing, unmanaged stress. Deep sleep at night is precisely when your body naturally produces testosterone. When sleep gets fragmented, whether from nighttime bathroom trips or anxious thoughts running through your head, that hormone production drops, and as I explained earlier, when testosterone drops while DHT stays elevated, the prostate continues to enlarge. On top of that, ongoing stress from work, finances, or family pressure raises cortisol, your primary stress hormone, which further disrupts hormonal balance and fuels inflammation throughout your body. This creates one of the most frustrating cycles I see in my patients. An enlarged prostate causes frequent nighttime urination, which fragments sleep, which disrupts hormones, and disrupted hormones make the prostate enlarge even further, a loop that feeds itself unless you interrupt it directly. Aim for a genuine 7 hours of sleep each night. Keep your bedroom quiet, dark, and on the cooler side. Put your phone down at least 30 minutes before bed. And if your mind tends to race at night, try 10 slow, deep breaths lying down before you try to fall asleep. Research consistently shows this simple practice measurably lowers cortisol and improves overall sleep quality. None of these 5 habits are particularly dangerous on their own, if you only did them once. It's the daily repetition, year after year, that quietly builds into the problems so many men experience after 50. Now let's talk about what to actually avoid in your diet, and a few simple, practical additions that genuinely support your prostate in returning to a more stable, balanced state. I often tell patients that taking 10 different supplements while keeping 10 bad habits is like trying to fill a bucket that has a hole in the bottom. Your body can't truly heal itself if you're still feeding the very things that trigger inflammation and hormonal imbalance every single day. So before we talk about what helps, let's talk about what needs to go first. First, sugar and refined starches, the real driver behind insulin resistance and the single most impactful yet overlooked factor in prostate health. Sugary drinks, fried foods, instant noodles, white bread, and white rice all spike blood sugar and trigger insulin surges, which, as explained earlier, feed prostate growth over time. You don't need to eliminate these completely, but gradually replacing them makes a real difference. Swap white rice for brown rice, or reduce your portion and add more vegetables to the plate. Replace an afternoon pastry with walnuts, pumpkin seeds, or a piece of fruit. Eating vegetables before your carbohydrates at a meal also slows down how quickly sugar hits your bloodstream. Second, cut back on coffee, alcohol, and tobacco, a combination that places tremendous strain on the prostate. Tobacco in particular is dangerous in a way most people don't expect. The chemicals in cigarette smoke damage the small blood vessels that nourish the prostate, starving that tissue of oxygen and increasing the risk of chronic inflammation. Research published in BJU International found that men who smoke face a meaningfully higher risk of prostate-related problems compared to non-smokers, along with a notably slower recovery. If you currently smoke, this is one more compelling reason to begin cutting back gradually. Third, avoid high-heat frying and heavily processed foods. Common cooking oils, repeatedly heated to high temperatures, produce oxidative compounds that damage cells throughout the body, and prostate tissue is particularly sensitive to that inflammation. Processed meats, deli cuts, and canned goods often carry heavy sodium and additives that irritate the bladder and strain the kidneys. Switch to olive oil or coconut oil for cooking. Prioritize steaming, baking, or light sautéing over deep frying, and if you do fry occasionally, use a non-stick pan with minimal oil and moderate heat. Fourth, avoid eating late at night and drinking large amounts of water after 7 in the evening. Late dinners force your digestive system and bladder to keep working overnight instead of resting, and your prostate doesn't get the downtime it needs either. Eating late also spikes blood sugar right when your body is supposed to be focused on repair and recovery. A practical guideline is to finish dinner before 7, or keep anything after that light. Avoid drinking water within 2 hours of bedtime, and if you genuinely feel thirsty at night, take a small sip rather than a full glass. Now for what actually helps. 15 to 20 minutes of morning sunlight, ideally between 7 and 9, lets your skin naturally synthesize vitamin D, and exposing your arms and legs rather than staying fully covered makes a real difference. This is genuinely the most effective, safest, cheapest way to correct a vitamin D deficiency. Regular movement matters just as much. Walking, swimming, gentle hip mobility work, or pelvic floor exercises, all of which improve blood flow to the prostate and support better bladder muscle control. A well-known Harvard study tracked over 30,000 men across 16 years and found that those who exercised at least 150 minutes a week had a significantly lower risk of prostate-related urinary symptoms than men who stayed sedentary. You don't need intense workouts. A consistent 30-minute walk each day is genuinely enough to shift the needle. A handful of specific foods have research behind them too. Cooked tomatoes are rich in lycopene, an antioxidant your body absorbs even better when sautéed in a bit of olive oil. Pumpkin seeds are an excellent source of zinc, and your prostate holds the highest concentration of zinc of any organ in the body, so a deficiency leaves it noticeably more vulnerable. Fatty fish like salmon and mackerel provide omega-3 fats that support reduced inflammation throughout the body. Green tea contains catechins, Plant compounds early research links to better prostate health, though more research is still needed. Dark leafy greens like kale and spinach round things out with additional antioxidant support. One honest note about supplements. There are plenty of products marketed specifically for prostate support, and I'm not against using ones with clean, transparent ingredients, but no supplement replaces genuine lifestyle change. Taking pills while still staying up late, drinking heavily, eating excess sugar, and sitting all day simply won't produce meaningful results. And if you're genuinely struggling with these symptoms, please see a urologist for a proper evaluation, because not every case of frequent nighttime urination has the same underlying cause, and some situations do require earlier medical intervention. Let me leave you with the most important takeaways from today. An enlarged prostate isn't simply a consequence of getting older. It's the accumulated result of years of hormonal imbalance, metabolic strain, and daily habits most men never think twice about. Elevated DHT, chronically high insulin, low vitamin D, low magnesium, combined with 5 everyday habits, that's the real formula behind a prostate quietly enlarging year after year. But once you understand exactly how this works, you have the power to change it, and you don't need to overhaul your entire life overnight. Start small. Stand up every 45 minutes if you sit for work. Stop drinking water after 7 in the evening. Skip that afternoon coffee and reach for herbal tea instead. Get 15 minutes of morning sunlight. Prioritize real sleep and aim to be in bed before 11. Stay consistent with these small shifts for a few weeks, and you will genuinely notice the difference. And one final thought, if you haven't had a proper checkup recently, your prostate isn't just about how often you use the bathroom. It's a real window into your overall health, your hormones, your metabolism, your sleep quality, your energy, and your confidence too. When you take real care of your prostate, you're taking care of your entire body, and that pays off not just for you, but for the people who depend on you. If today's video gave you something useful, please share it with the men in your life, especially anyone over 45. This is information most men never hear until it's already a serious problem, and it deserves to reach them earlier. If you'd like more straightforward, practical guidance like this, subscribe to Senior Diet Coach and turn on notifications so you don't miss the next video. Every week, we break down real, evidence-based ways to protect your health as you age, one simple habit at a time. I'm Dr. Samuel Reed, wishing you strength, better sleep, and steady health for the years ahead.